Oh, Matt, I'm doing Football Focus in my house. I'll be honest with you, I have rearranged my books to make me look more intelligent. Have you done the same?
Do you know? No, these. I mean, we've had so many chefs on the One Show over the years. And one of the perks is you always get a cookery book when they come on, because obviously you've got to look through and talk about the recipes. So this is a bank of it's an archive of cookbooks from the One Show. Which, yes, sits at the end of our kitchen, which is lovely to go to.
I'd love to know how many you've actually looked at and baked from, or what.
Just massive respect to extraordinary staff who are working under incredibly testing circumstances. I think the public's attention has obviously been very much on staff in the NHS working in acute hospitals and GP surgeries and so on. But here's another group of staff across the mental health system who are doing incredible work to keep people safe. Inevitably, there is no risk-free option.
Of deep inequality and intense polarization, and yet contending with it requires resources of solidarity that are not easy to summon. I think one of the moral lessons of the pandemic thus far is how mutually dependent we
would. Deaths go up, which are not labelled as COVID. And the first one I think that people would come to is that maybe these are associated with COVID. At the moment, the Office for National Statistics reports that less than 10% of COVID deaths are out of hospital in care.
Enormous efforts into generating additional testing capacity, and we've got these super labs which will be capable of conducting tens of thousands of tests a day. It's just starting to come on stream. So I understand that Manchester opened at the end of last week.
But not with an antibody test.
Well, this is the two types of.
I mean, it's not just schools that where they're not going into schools. Actually, health visitors won't be knocking on the door anymore. For most families, social workers will be down the line. Even the place to register births is now largely closed. But babies will carry on being born at a rate of about 1,700 a day. So,
you know, chatting to friends via Zoom or on other software applications, we know isn't the same for us. And it certainly isn't the same when it comes to therapy and treatment, you know, which relies on personal contact.
For the royal family, right from the start of the outbreak, William and Kate, of course, went to the NHS 111 call centre right at the start. William yesterday was opening the Birmingham Nightingale Hospital, the Prince of Wales opened the London one. We had the Queen making 2 historic addresses within the space of a week. It's a really interesting point, I think. You know, a lot of people
precarity of employment, of income, of food and of housing.
And you talked about the disease of despair.
The diseases of despair, exactly. And those are the diseases which have been rising, the deaths that have been rising from those causes in the United Kingdom, in the United States, to a greater extent than in other industrialised countries over the past 10 years. However, we also know that there is a lot that you can do to mitigate the effects of
army of relatively low-paid, low-status jobs in retail and cleaning and indeed care, as you say. But I mean, the idea that
begins to tackle the issue of fear in the population and to restore confidence, because otherwise the lockdown strategy will fail simply because people won't go along with it.
1 in 5 of all deaths in England and Wales in the week ending April the 3rd are linked to coronavirus, with the overall death rate pushed to a record high. That includes 406 people who've died with the coronavirus outside hospitals, more than half of them in care homes.
Who gets the infection, and we don't know that because of the lack of testing, the lack of diagnosis out in the community. The second is if you've got other conditions, as Jane Draper was just reporting, you're overwhelmingly much more likely to have severe infection and possibly fatal infection. And we know poorer people are more likely to have conditions such as diabetes, chronic obstructive pulmonary disease, hypertension, obesity. And the third is the consequence